I'm Walter Willet, and I'm chair of the Department of Nutrition at Harvard School of Public Health. Our country, and indeed most countries in the world, is facing a very serious problem with the rising rates of obesity, truly a massive increase. This is occurring in people of all ages, but especially in children. When we look at what people are eating through national surveys, it should come as no surprise that we're having an obesity epidemic, and on top of that, an epidemic of diabetes. The amounts of sugar-sweetened beverages, refined starches, products that are over-refined in general is huge, and far too few Americans are getting adequate amounts of whole grains, nuts, and fruits and vegetables that we know help control obesity and contribute to health in many ways. It's pretty clear what will happen if we don't address the obesity epidemic very directly and in a strong way, that already we see parts of the country where life expectancy is on the decline, and the calculations show that that will spread across the United States. And that's a new phenomenon because for many, many decades, life expectancy is getting better and better. But particularly in parts of the population with less income, less resources, the decline in life expectancy is already happening. The causes of obesity are complicated and multiple, and therefore there's not a simple single answer to the solution to solving the obesity problem. We need, it's very clear, to have a multiple-pronged approach, and that needs to involve schools, healthcare system, work sites, the physical environment, so everyone has a safe place to walk, to ride a bike, to play. Certainly we need a revolution in how we think about food and how we act about food in terms of eating as well. First of all, that should be based on the best available scientific evidence and as sound and as secure as the evidence can be. But equally important is the translation of that knowledge into foods that are attractive, satisfying, as well as healthy. We know that that's possible, but to make it happen, everyone will need to be involved.